Dr. Bob Ganz, happy Friday to everyone. I want to talk to you about a study that I just saw out of the Journal of the American Medical Association looking at marijuana, cannabis, cannabinoids. Cannabis is the plant, cannabinoids are the chemicals from the plant that are supposed to have benefit. And this was a study, good study from multiple psychiatric departments looking at the past 15 years of high quality trials of marijuana and medical benefit. So this is randomized controlled trials. And marijuana is approved by the FDA for two indications: cancer-induced loss of appetite or anorexia, and cancer-induced nausea and vomiting, and or chemotherapy-induced nausea or vomiting. And to be honest with you, there was a very slight benefit in those two things, but very modest. But there was no other benefit for anything else, not for mood, not for insomnia, not for abdominal pain. Now, just as a way of background, the human body has an endocannabinoid system. We have all these receptors that are natural to our body, and we have endogenous endocannabinoids. We make marijuana-like chemicals that bind to marijuana-like receptors in our body. And that's a very vast endocannabinoid system, and that's in the human body for various purposes. It does all kinds of things. It's basically divided into two types of cannabinoid receptors, CB1 and CB2. CB1 is in the brain and intestine, and CB2 is in other organs of the body. And this endocannabinoid receptor system modulates mood and gut motility, abdominal pain, appetite, all kinds of other things. So there was a good reason to think that giving endocannabinoids to stimulate this endocannabinoid system that's endogenous, that we all have, would be beneficial. Unfortunately, in this study, the benefits just weren't great. But here's the bad part. Here's the really bad part. Heavy users of marijuana in this meta-analysis of all these studies had a double risk of stroke. Heavy marijuana use doubled the risk of coronary disease and doubled the risk of heart attack. In addition, it roughly doubled the amount of psychotic episodes that people had, things like major depression, schizophrenia, and it doubled the risk of generalized anxiety disorder. So summing up in this study, a very modest benefit for loss of appetite and weight gain and nausea and vomiting in cancer chemotherapy patients. Very modest, not much, a little bit of a benefit, but almost no benefit for anything else that could be proven scientifically, and a ton of really serious side effects: stroke, heart attack, and psychotic episodes. So, and generalized anxiety disorder. So, be forewarned. You got to, if you're going to be a heavy user of marijuana, you have to understand the risks involved and the fact that there's not going to be tremendous medical benefit. Okay, that's all I have for you today. I thought that was a really interesting study. Everybody take care, have a good weekend, and we'll tackle some other topics in a few days.